person working in this area of uh, autism and related disorders right from the beginning. So I take this opportunity to welcome Dr. Raveendar Dasarapu, and we are eager to hear his views on Asperger's and adulthood, which is a rare topic, but which is a much needed topic because children with autism who were predominantly diagnosed at that particular period of time, that is in the during 2000, during the late 90s, the diagnosis was coming up quite in a big way. The diagnosis came up in a quite big way, and now those children must have come into adults. So we should be knowing exactly what to do with them, and who else better than Dr. Raveendar Dasarapu can speak about it. Dr. Rajesh Ramachandran also has quite a bit of experience in writing books, doing quite a number of webinars as well as activities which are touching to people with autism and disabilities, which are out of the box activities as well. So let us hear Dr. Raveendar Dasarapu. I welcome him and formally inaugurate the program. Where is Dr. Raveendar Dasarapu? I can see him.
Can everybody see me? Thank you for your kind words, sir.
Welcome.
I appreciate that.
Namaskaram.
Namaskaram.
Sir, if you please allow 2 minutes for me to speak about Dr. Raveendar.
Sure.
Thank you, sir. Good morning, everyone, and we thank our director, sir, for giving us such a wonderful introduction for the webinar series, Asperger's and Adulthood. Today, a short brief about Dr. Raveendar Dasarapu. Raveendar Dasarapu, as director, sir, was mentioning that he's his friend and philosopher, and a lot of things that has been learned by Dr. Raveendar Dasarapu. He's a special education teacher with 26 years of experience. He's originally from Kottagudem, Telangana, and he's a dedicated and passionate special education teacher with more than 26 years of experience. He's presently residing in Atlanta, Georgia, US. Dr. Raveendar has worked with a wide range of special needs students, which includes those with autism spectrum disorder, emotional and behavior disorders, intellectual disabilities, severe and profound intellectual disabilities. He's fluent in Telugu, Hindi, and English. He has developed a strong cross-cultural understanding, which has enriched in his teaching practices. He completed his special education course at the National Institute for the Mentally Handicapped, now called as National Institute for the Empowerment of Persons with Intellectual Disabilities, in the year 1996, and embarked on a rewarding career serving in various educational institutions across India, likewise said by our director, sir, Hyderabad and Bhopal, as well as in the United States. Dr. Raveendar remains committed to creating inclusive learning environments and advocating for the needs of students with disabilities. His extensive experience and deep empathy and continue to have a long-lasting impact in the lives of the students he served. May I have the pleasure in inviting Dr. Raveendar Dasarapu for his session. Over to you, sir.
Dr. Raveendra, you are mute.
Sorry, happens. I'm glad to be here. Thanks for the kind words, Director Nachiketa, sir, and Dr. Ramchandran. Thanks for your kind words. And this came out as out of the bloom. Like me and Rajesh quite often talk and then discuss, but this came out as okay, let's do this, and this is the right time for talking about Asperger syndrome and adulthood. So quite interesting that this month we are celebrating as Asperger's Day, right, on February 18th. And then next month we will have Down syndrome day. And then every month we'll have one syndrome. So when we talk about Asperger's syndrome, is it really Asperger's syndrome or a disease or it a condition? Like we compare with autism. So what are the differences between autism and then Asperger's? So I'll ask someone to move the slides and I'll go over it.
So you want to move this one because now it is Asperger's and adulthood. Shall we go next
Correct.
one?
Yes. Next slides, please.
Yes, sir.
Let me open on my end. Like I drawn quite a things from this book. It's called Asperger's in Adulthood, and then you can know on the slide more about the other from the second slide, and then Asperger's syndrome, people called as ASPI, you know, they have to give some name, recognize a person as Asperger's syndrome, they call it as ASPI. So ASPI students are, they are very detail oriented and they are very intense in concentrators and they are tech savvy. They are wordsmith, like a blacksmith and then goldsmith, how they mend the things. So these kids with Asperger's syndrome, they mend the words and that's why they call it wordsmith. And they are loyal, honest, and punctual. And then in tune with kids and elderly. Like when they wanted, they become elderly. When they wanted, they become uh, kids. So how they function in different environments. So that those are their strengths as Asperger's. Next slide, please. So there are facts and myths. So when we talk about Asperger's, quite interesting to know. All people with Asperger's syndrome are exactly same. Is it true or false? There we're talking about Asperger's and autism, right? So this is false. All people with Asperger's syndrome are not exactly same. There could be medical condition, there could be behavioral, there could be social, there could be sensory, but they are not the same. Number two, Asperger's syndrome is high functioning autism. But in any case, even if, in spite of having all the social issues, sensitive issues, behavioral issues, they are considered as high functioning autism. They're intellectually high functioning, and that's true. Number three, all people with Asperger's syndrome can have meaningful jobs and live independently. And when they reach the adulthood, you might not notice those things which you come across when they're child. So that's why they can do jobs like you and me do quite a bit jobs. They can do it independently. Next slide, please. And when you are dealing with the Asperger syndrome adults, you have to choose battles wisely because they can go in any extent. Like if you irritate them or if you don't align with what they are
இது மியூட்
asking,
இல்லாம
and then you got to choose battle wisely. Do you really want to do this at this point? So that's why it says choose battles wisely. And being told what to do. Like you cannot directly tell them, okay, do this. In a way, you have to come around and do like wordsmith words and then told them what to do. And number three, they might be having sensory overload. You might not know that environment might be more stimulating or overreacting to them. Like when they go to public places, when they are in lighting situations. So those places, and you have to talk about sticky situations in terms of Asperger's adults. Next slide, please. The school and its role as Asperger's education. So what can we do in the role as Asperger's education? One, sensory integration therapy we provide. Number two, cognitive behavior therapy. Number three, medications. Executive functioning training help for insomnia. You all know this, like people with Asperger's and autism, they might not get sleep very well. So you have to calm them, help them to get into the sleeping mode and habituate them to do exercise and expanding food origin. Some kids and even adults, they don't like sticky food. They don't like sloppy foods. They don't want more onions in the food, more chili in the food. So you have to expand their horizon, what they like, what they don't like it. So in although we educate, but we have to take care of these things like sensory, cognitive, medication, and executive functioning training, like how you tell them the correct situations. That's why it's called as executive functioning. Next slide, please. Okay, this is, I draw some of the things from the book called Invisible Differences, a story of Asperger's adulting and living a life in a full color. So it's asking what is autism or what is Asperger's syndrome? What is it? So there are quite a bit differences. Once you know these differences, it's easy. It will be easy for you to understand in a long run. So on the picture, next slide, please. On the picture, you will see here there is a survival kit that's provided for Asperger's kids. That's promoting self-esteem and self-regulation. They can have a keen eye for details. For example, some find jobs running specialized tests on software programs. And folks living with autism spectrum disorder can be honest and then respectful of rules. When interested, it's possible to focus their attention on something intensely for hours. So they have a few prejudices and are less likely to judge others. So quite often you know from them they are not critical. For everything they'll say yes, but they will not be more judgmental. So for to promote the self-esteem, there is a survival kit they are given. Like when they want to sleep, like earlier we talked about help them get to sleep. We provide them sleep mask, like putting it on ice, and then noise canceling headphones. So that way they cannot uh, take more auditory sensory load. And then soft, loose fitting clothes, and then sometimes you can provide them earplugs. So that way they can block more noise. So these in general, we call it as a survival kit. Next slide, please. And there are some relaxation techniques for children and adult. So in the picture, it's given because it's all like America, France, and everywhere research is going on, and those provided in terms of foreign countries, not necessarily Indian other environmental conditions. But so small talk with neighbor faced with an impromptu, informal conversation, and then I echo back. So they can hear, but they don't know how to respond. So at this place, how they can relax and what makes it sense for them if they go to different situations. They go to salon, they go to movies, they go to public places, or they meet a neighbor. So in general, what a lovely day, the neighbor says, and then, yeah, what a lovely day. So instead of that, is it going to rain today or is it going to be sunny? So these kind of conversational skills, we need to equip with them. So that's why we're preparing them for adult. Next slide, please. So relaxation techniques for children and adults. Some may find conversation a source of fatigue. So, for example, an hour of socializing often requires an hour of rest and recovery. So, who does that when you are really tired working for 1 hour? You need rest, right? Similarly, these Asperger's adults, when they work for 1 hour, they might require 1 hour of recovery stage. Similarly, autistic people often recharge best when they are alone. So, giving themselves over to their interest, like they want to play games on the phone or they want to interact on social media, they want to watch simple videos. So, we have to give them the space. Next slide, please. So, the family comes first, and the first setting for that's the emotional management. So family has to help them, obviously, right? At the school environment, we are there as a special educators. We take care of their behavior, sensory, and motivational management. Whereas the family, that's the first setting for emotional management. So it says that, hey, check my new dress. Yeah, nice, right? So when somebody asks, check my nice dress, and obviously other people say, no, I don't care for what you wear. But again, they are not the best liars. They cannot lie. You know that, right? As per these kids, they are loyal. They cannot be judgmental. They cannot lie. If somebody wearing a bad dress also, and they'll say, yeah, I don't care, but they don't give judgment. So you have to understand these between the lines when they talk. So sometimes they might be clumsy. Suppose if you give sensitive thing to hold or do the job for us, and then you have to be careful. Sometimes they might be clumsy. They might break the things. Next. So dictionary of their own expressions. Asperger syndrome kids and adults, they will have dictionary of their own expression. They will not say I'm hungry, but they'll say, okay, I got two hands. That means my hands are empty. I need something to hold in my hand. So that's how they develop their own expressions. So as they grow up, Aspies will gradually build their own dictionary of expression. That said, it's possible to continue having trouble with the double meanings, so making it harder to understand instructions correctly, whether in a school setting or later in life at the office. So in the picture, you'll see the swimming in his shoes. That doesn't really mean in literal meaning, but they have developed their own expression. Each individual developed their own expression. So that's developing dictionary of their own expressions is a peculiar thing for Aspies. Next. So we go to another presentation where we talk about, can you go to, can you go to part 3, please?
Which one, sir?
Part 3 presentation.
Child-friendly movies and TV shows. That one.
Correct. Yes.
Just a second, sir.
Sure.
Yes, sir. It's done.
So this is the few slides I prepared based on the information available on the internet. So there are child-friendly movies and TV shows. So movies featuring autism and Asperger's. So visually, when you see how other person is acting up, how other person is reacting, then you will know this characters what that means. Anybody watched the movie called Inside Out? There's a part 2 came also this year, but this talks about mostly about autism and their emotion regulation. It's quite interesting. When you watch first time, you might not understand, but as and when you get into the movie, you will see the different characters have different emotion. So each color represent each emotion. Next, please. I didn't get to watch this, but it's Please Stand By. That's the movie. And then it talks about a young autistic woman runs away from her caregiver in order to boldly go and deliver her 500-page Star Trek script to a writing competition in Hollywood. That's one of the movie you can watch. That's I think that's available on Amazon Prime. Next. Adam is another movie that came in 2009, and Adam is a lonely man with Asperger syndrome, develop a relationship with his upstairs neighbor Beth. That's just adult how when they grow older, how they react to social situation. They want to have life of their own, right? So this movie talks about different relationships. Next. I think this movie also came in India. I think in Tamil it was Vikram, and then in Hindi it was, I think, Ajay Devgan. They acted in this movie. It remade into Indian cinema. The story of an artistic man living independently and functioning well in the real world until his life changes drastically when he becomes a father and is left to care for his small child. It's called Am Sam, that came in 2001. Next, please. I think that is Atypical is that came in 2017 as a comedy drama, and you will learn more when it is mixed with comedy and drama and stuff. Straight information, relationships. So this is heartfelt comedy flows at Sam as a teenager on the autism spectrum. So who has decided he is ready to romance. So these things, when they become older from the school age to the teenage to the high adulthood, you will realize that, oh, did I miss it something when they're in school, or did I miss when they're teenagers? When they become adult, how they act, how they progress in their life. So that's, you can learn more from the movies. That's the basic idea of me giving you these exist. Like you and me can talk hours together. Okay, Asperger's is this, and there are the features here. But visually, it makes more sense when you watch this kind of movies. Next, I think that's. Uh, let me see. Can you go to presentation two, please?
Is that on key characteristics of autism and Asperger, or autism and Asperger story? And
It's Asperger's adulthood. It says presentation two. It's a PPT.
just a second, sir.
Sure. Yes, that's the one. Okay, that's the Asperger's adulthood, and is supposed to be coming fast, but we jumped in. And to define Asperger's syndrome, today's goals are identify common signs and treatment options for Asperger's syndrome, outline ways to help a child with Asperger's syndrome in the classroom. Next, please. So, what do those words mean? Autism spectrum disorder is a brain development disorder commonly diagnosed before age 3 with impairments primarily in social interaction, communication, and restrictive repetitive behavior. You all know the DSM 4 we practice, and that's a diagnostic and statistical manual of mental disorders. And that lists the different categories of mental disorders and the criteria for diagnosing them. So common names for Asperger's syndromes are AS, Asperger's syndrome, and Asperger's. You can see at the bottom where I got this information, and that has been retrieved
Yeah.
from Autism Speaks. September 22, 2007. You can find this information on the web too. Next, please. So, what is Asperger syndrome? An autism spectrum disorder that affects language and communication skills. Like earlier, I was talking about the treatment options, what kind of therapeutic interventions are available. But here, the classic example you will see autism spectrum disorder that affects language and communication skills in Asperger syndrome. So, children with Asperger syndrome have trouble reading facial expressions and people gestures. They find it difficult to identify and express their feelings. They may also have hard time connecting to other people, such as classmates. Next. Next, please. Okay. According to the DSM-4, the TR is teacher rating scale. So in DSM, there are two versions available. TR is the teacher rating scale. Asperger syndrome must fit the following criteria. One is qualitative impairment in reciprocal social interaction and qualitative impairment in communication, restricted, repetitive, and stereotyped pattern of behavior, interest, and activities. So these are the some of the criteria you look in when you rate the scale while doing the assessment. Next, please. So whom does Asperger syndrome affect? I think these statistics are from the US, but I'll just read out for you guys. So over 400,000 families are affected by Asperger syndrome. It is estimated that 2 out of every 10,000 children have been diagnosed with this disorder. Asperger syndrome affects boys more often than girls. So Asperger syndrome is usually diagnosed between the ages of 5 and 9. So earlier than 5, we cannot diagnose. Although you see the symptoms, although it fits the criteria, but never ever try to diagnose before the age of 5. You can catch them, you can see between the age of 5 and 9. There are interesting things to know why you should not diagnose before the age of 5. Next, please. Common signs of Asperger syndrome. So the peculiar mannerisms such as odd speech patterns. So they may sound like little professor. They're going on digging more information and then talk about certain things. And you might think that, hey, why this talking like a professor? Few facial expressions and difficulty reading others' body language. And they will have unusual sensitivity to light, sound, smell, taste, and touch. Like this, I mentioned earlier that you can use survival kit. Like for the sound, you can either provide them with earplugs or headphones, sound masking things, and then smell, taste, and touch. For this, you can give them loose fitted clothes. So that way, the unusual sensitivity can be regulated. And then obsession with a single topic such as music, dinosaurs, cars, or the mechanics of a toaster. If they see a toaster, how you make the bread warm, that's called toaster. And then instead of eating the toaster, they talk about how this toast maker is working, the function, the mechanism. And then dinosaurs extinct, right? We will not know on a daily basis, but these kids, they're obsessed with dinosaurs and that talk about different music and then cars. These are the peculiar obsession they will have as Asperger's syndrome kids. A need for routines and rituals and consistency, such as familiar morning routines. So you cannot just cut the line and then go to the next. They will have a peculiar morning routines. They have to do 1, 2, 3, 4 in the order. But if you take out three and they go upset and then they throw the tantrums. So they a need for routines, ritual and consistency need to be there. And lack of common sense and an inability to identify social cues. So these are the common signs you'll come across in Asperger's syndrome. Next, please. So, what are some treatment options? Although there is no particular treatment for Asperger syndrome, the most effective approaches are therapies that focus on improving poor communication skills. So, whose help we should take? We should take speech therapist help to improve their poor communication skills. And they have obsessive, repetitive routines, and they have physical clumsiness. So these you will have a therapist, physical therapist, occupational therapist, behavior therapist. They all will be there to help us give more notes on how to help those kids in the classroom. Other treatment option may include education and training for parents, social skills training, language therapy, and specialized help in school for the child. So these are the some treatment option you can consider. Next. So there are some biological factors. There are no definitive research studies that point to a particular problem in the brain that can lead to autism or Asperger's syndrome. Many might think that okay, this could be genetical, this could be cold parenting, or this could be a family history of this, but no, there are no definitive research studies done so far in Asperger's syndrome. And same with autism. And recently, you might be knowing more about vaccines and other latest information. But as far as my studies and my understanding, there are no definitive research study that can give us this could be the reason. Next, please. Family factors. Asperger syndrome is not related to parenting practices, how child is raised by his or her parent. So we cannot always blame parents for how this kid is acting or how this kid is growing up as Asperger, right? There is nobody's fault. It's not a single cause that making that kid behave like this. So always remember this. But family comes first and then kid. So they are more kids are more precious, right? So you have to make a note of this. So by telling parents that no, you have to do like this, that you are offending parents' feelings, or it's not good to say something like that. So Asperger's is not related to parenting practices. Each family have their own brought up, and then they have their own skill set grow the kids, right? So in terms of Asperger's syndrome, Asperger's kids, there is not related parenting practices. Next. So don't try this at home or school. With the Asperger's students, don't use humor because they don't understand. They cannot be judgmental. They cannot be critical, right? If you think that you can use humor, that's not going to work. Then there should not be any sarcasm or idioms without explaining what you mean. In general conversation, we might say, but that's not going to help anyone if you're dealing with Asperger's students. So don't ignore the students' complaints, no matter how menial they seem to you. If they are saying something and you might not believe that, but don't ignore it. So don't randomly change the child's schedule or routines or rituals without previous notice to the child. So in the classroom, when the kids comes in, they always have a schedule, what to do, what period is this, and the next period what you're going to do. And there will be a chart displays, first this and next this. And this hour you are working on this, next hour you are going to work on this. So if you change that, and you're going to mess it up, and you're going to see the sticky situations I mentioned earlier. So you have to choose your own battle. If you change the schedule, you change the routine, then you are picking up the battle with that kid. So don't confront the child in a public setting. Never ever. As an adult, you never confront anybody, right? Even your friend or your neighbor, anybody. Don't do that in the public. Similarly, don't confront the Asperger's child in public setting because that's not going to help because he won't understand. The child won't understand the expectations in public setting, but confronting not going to help. Don't ignore or minimize the signs and symptoms. Ignoring negative behavior doesn't make it go away. So those are the things. Don't try at home, at school. Next, please. So now what? Now that you figured out what not to do, let's unpack those tools that will help you in your classroom. Next. So how do you help your students? So there are 5 domains that need to be addressed. They include, like earlier we mentioned, communication skills, social interaction skills, sensory skills, behavior skills, and academic skills. So all these 5 domains, you will have 5 people already there with you. One speech therapist for communication skills, social interactions, sensory skills, you can take the help from occupational therapist. And then behavior skills, you have a behavior interventionist, behavior therapist available. For academic purposes, academic skills, you have a special education teacher available for these 5 domains. It's a collective effort. You all need to share the notes, exchange the information, then come up with the plan. So that's the game plan for these 5 domains. Next, one communication skill. What does the problem look like? So when we talk about communication skill, what it could be. So it could be difficulty asking for help or figuring out what the task is. And they can easily confused by complex directions and talking at the same time as others, making statements that seem out of the blue, and saying things that seem disrespectful, inappropriate, or argumentative. So these problem communication skills, you will see they might be arguing, they might be making statement that's out of the blue, and then talking at the same time as others because they don't know the social norms, right? They got to wait for others to stop, then they can talk. So these are the communication skills you look in. Next. So how do I help? Break complex directions down into smaller pieces and repeat instructions and make clear and precise statements. Like I said earlier, don't confuse them. So you have to make up your own statement that should be clear and precise. And when you are going to use sarcasm and then humor, explain beforehand. Explain sarcasm, metaphors, idioms, and words with a double meaning. Help the student find a phrase or a signal for when he or she does not understand the directions. So they could get confused easily. So you have to come up with these strategies to help in communication. Next. Social interaction skills. So, what does the problem look like? Inability to read facial cues or body language, unable to pick up on verbal and non-verbal social cues, difficulty making small talk or conversation, and trouble understanding emotions of themselves and others. Because if others are crying, they don't know why the other person is crying. If other person is sad, this Asperger's kid may not be knowing what it could be. So they might be having a difficulty making small talks. So don't expect them that they're going to involve in conversations. Next. Now, how do you help as a social interaction skills for this Asperger's student? Protect the student from bullying and teasing. If this kid is talking out of the blue and then not sustaining the conversation, what you could do, you could stop this because other student might think that it's easy to tease them, it's easy to bully them. So for this, you have to pair the student with buddy, like a friend, and who can act as a social mentor or a peer helper, like same age kids who does better job than that as per the student, you can make them as a buddy. So know the difference when he's isolated by choice and when he's isolated because peers won't include him. And explain Asperger syndrome to those classmates. Help the student understand use of a humor. So these social skills you can understand and help that student in the classroom. Next. Sensory skills. What does the problem look like? Increased sensitivity to sound, light, taste, touch, and smell. If somebody is eating samosa and they might take onion out of that samosa because they only like the bread, and those sensitivity towards the taste. And then a student with Asperger syndrome is prone to notice the tapping of pencil, of the humming of the overhead fluorescent light. So we might not notice, but kids with Asperger syndrome, they notice like someone is tapping with the pencil or the humming of the like, tube light. So sensitivities may make those students anxious and stressed over react and difficulty staying focused because of sensitivities. The need to deal with the sensitivity quickly because the student may get overwhelmed and overreact. So those are the sensory overload things you can see. And next, how can you help? And you can predict a sensory environmental changes and make the student aware of them before they occur, giving the student a chance to prepare and adjust. Here you can provide a personal kit where the environmental sensory overload, they can regulate themselves. So provide a personal quiet space for the student to relax and collect all the thoughts. Allow the student to have calming item to use when experiencing sensory issues. Like you can provide them with stress ball and then worry rock, etc. Those are the simple things you find in other places. Next, behavior skill. This could be more you see, but when you look at the behavior skills, they are not that dangerous. They are not that difficult to manage because those problems look like egocentric. Because the kid is behaving bad, as a teacher, my ego hurts, right? As a parent, my ego hurts because my kid is behaving bad or my student is behaving bad. So those problems, and the same with the student too. If they want to do something and teacher won't letting it happen and their ego hurt, and those are problems are mostly egocentric. Like the kid want to sit in the first row and teacher won't allow it and that kid's ego hurt, and then that's where the scenario starts, and those are the sticky situations where now you pick your own battle to deal with it, and they get easily annoyed, agitated, and impatient, tendency to state exactly what is on his mind. Then they will have mood swings, and they are perfectionists. You all know this. That's really hard for others when mistake is made. If we make a mistake and they noticed it, and that need to be perfectly done. That's typical with Asperger's students. So inclination to get stuck thinking about a problem or special interest. Suppose if they are doing the math and if you tell them use the calculator, they use their own calculator only, not from the computer or not anybody's other computing device. So they are stuck with thinking about the problem. And suppose if you tell them to write and they use particular pen only they need or pencil only they need. So those kind of behaviors and you notice it, but it's easy to regulate and manage very well. Next. So how do I help when I see the behavior skills? So model acceptance of the student for peers and don't take the student's comments personally. If they say something, it's not going to be personally aimed at you, right? So don't take it those comments personally when you're dealing with behavior of those Asperger students. So use the student's special interest to engage in conversation or class discussions, and then be consistent and clear in your expectation. Teach the student replacement behavior for when she is frustrated, angry, or anxious. So this out of communication sensory behavior is easy to manage, easy to address, because everything is situational. At that point of time, how you teach the replacement skills is most important. Next, please. Academic skills. So, what does the problem look like? They have some strong concrete objects such as math and science, while weak in abstract areas such as language arts. Did anybody notice this so far? They are good at math and science, but they're poor at language because language involves more communication, sustaining conversations, and using more words, right? Whereas math, two is always two only, right? It's not going to change. But whereas language, the word going to change situationally or place to place, environment to environment. So that's the weak area. Unable to find the main idea and avoiding certain subject he is comfortable with or uncertain, and they are overstimulated by lengthy activities. That's why we write task analysis, simple things, make a bigger things into simple chunks, right? So those are the academic skills. Those are the problems you come across. Next. So how do I help while dealing with academic skills for these Asperger students? Be calm. And once you calm, everything going to be easy for you to deal with that student. So a matter of fact, and predictable when teaching. Give materials, directions orally and visually. Present with visually, like how what you're going to do next, and use concrete examples when teaching. Use predictable classroom routines, rules, expectations, and provide frequent positive feedback. Positive feedback is like praising them. Yes, you are doing great job, and I like the way you are working. So these kind of things you can use to help those Asperger student in academic skills. Next, please. So on these slides, those are the references I used, and I already mentioned. And I thank you, Jessica Yamajki, applied developmental psychologist at University of Pittsburgh, and that's was adapted from that presentation. How much time we got, sir? How much time left?
You tell, sir.
Okay, let's open part 4 as key characteristics of autism and Asperger's. Thank you, sir. I think let's see the key characteristics of autism and Asperger's. So on the left side, you'll see autism, and then on the right side, Asperger's on the screen. I'll read out the autism and then Asperger's. Significant delays in language, maybe nonverbal or have limited speech in autism. Whereas in Asperger's, there's typically no language delay, advanced vocabulary for age. So they talk more than their age. Like if 3-year-old kid is there, and most probably talking about 6 years of age because of the vocabulary. And whereas in autism varies widely from intellectual disability to above average intelligence. Whereas in Asperger's, usually average to above average intelligence. And then in autism, social interaction difficulties may show less interest in engagement. Whereas in Asperger's, their desires social interaction but struggles with social cues and nonverbal communications. So in autism, they exhibits repetitive behaviors, often with pronounced and inflexible routines. whereas in Asperger's, they exhibit repetitive behaviors, rituals, or intense interest in specific topics. In autism, they are hypersensitive to sensory input, including light, sound, touch, taste, and smell. Whereas in Asperger's, they may be hypersensitive to sensory input, usually less severe than in autism. This is just a brief idea of not to get confused while looking at autistic kid and then Asperger's kid. So that's the basic idea of me giving you um, the chart which says the key characteristic features. So can you go to number 4, sir? Oh, sorry, 5. Autism versus Asperger story and chart. That's presentation part 5.
Just a second, sir.
Sure.
I'm sorry, I'm unable to open it. I don't know, something
Oh,
stuck.
that's
Got stuck
okay.
here.
Let's open the why
For the discussion.
Asperger's. Let's one more and then I'll come for the discussion. Why
Yes,
Asperger's is syndrome but not autism? Can you
that is
open that one?
the Word document.
Correct.
Yeah, just a second.
Sure. Yeah, let's see this one. So why Asperger's is a syndrome but not autism? Why can't we call that autism syndrome? Why only Asperger's is a syndrome? Here is why. And there is a historical classification, and that's a psychiatrist named Hans Asperger in 1944. Yeah, 44. So he identified children with normal or above average intelligence who had difficulties with social interaction, repetitive behaviors. So it was originally classified as a separate disorder when 1944. So as the research progressed, as the people coming to know what could be the syndrome, what could be the disorder, and then now we have more clear understanding. The spectrum approach in 2013, when the release of the Diagnostic Statistical Manual 5th edition DSM-5, Asperger syndrome was reclassifies reclassified under the umbrella term autism spectrum disorder ASD. So this was done to reflect that autism is a spectrum with a range of severity and characteristics. Now people diagnosed with Asperger syndrome are generally considered to have high functioning autism. So there are differences in diagnosis. So why syndrome? Number 4, by syndrome. The term syndrome refers to a collection of symptoms that occur together. That's the reason Asperger's is a syndrome. Autism is not a syndrome. Asperger's syndrome was labeled as syndrome because it described a group of behaviors and characteristics that were seen together, even though it was part of the broader autism spectrum. So Asperger's and syndrome and autism are not separate conditions anymore, but rather Asperger's is now seen as a specific presentation of autism, typically with less severe intellectual impairment and no significant language delays. So while autism is the broader category under which these various presentations fall. I hope you understood what I was trying to say, why Asperger's syndrome and autism is not. I think that's all from my end. If anybody has any burning questions, I'm ready to answer if that's okay with you, Dr. Ramchandran.
Yes, sir. The floor is open for questions to Dr. Ravinder.
Sir, good afternoon, sir. I'm Dr. Sukumar, psychologist and special educator. And I would like to know about cognitive flexibility of these kids. Okay, I come to know cognitive deficit of autism children. The routines and rituals are because of sensory issues or because of cognitive flexibility issues.
Um, you asking me the question of cognitive flexibilities and communication?
Yes, sir. Yeah.
I really I'm not really sure what it is, but when we, as a special education teacher, when we write a plan, individual education plan, a treatment plan comes from the cognitive behavior therapist, CBT. So there could be flexibilities like based on the environmental condition, based on classroom structure, based on student abilities. But I cannot really frame out that what kind of cognitive behavior therapeutical flexibilities will be more beneficial for any Asperger's student.
Oh, okay, sir. Thank you. Thank you.
Thank you.
Mohiddin Bano, you had mentioned in chat box. So if you have any question, you can unmute yourself and you can ask. I think they have written it in chat box.
Chat. I cannot read the chat box.
Yeah, just
How
a
do I
second.
access?
No, not an issue. I'll just read out.
Okay.
They have given about information with regard to DSM-4 TR and DSM-5 2013. Well, I have. I'll ask on behalf of the participants. Dr. Ravinder, the way you teach children on the Asperger's, particularly I find when they are older enough, and you had mentioned about with regard to the interpersonal relationships that they have difficulty in managing those relationships. How in a classroom setup I'm sure it will be different entirely at your country, but how are you managing those interpersonal relationships when it comes to Asperger's?
I think it mostly social interaction. I teach high school, so in high school setup, all the kids they go to general education classroom. They will have 30 kids in other classrooms, so they will interact. And these Asperger's kids go to 30 kids in the classroom. We already alerted the teacher in the classroom. We already alerted the group of kids in the classroom about this kid, as per this kid coming into the classroom. So preparing them in advance and making them more friendly environment. So when they go to the gym class and me as a teacher and talk with kids who are more friendly and then develop social interactions. So asking them, hey, what did you eat last night? And what movie did you watch over the weekend? And those things might build more social interaction relationships. So it's always teachers take how those students can mingle and then frame those social interacting situation. And we will always have opportunities to go movies, and schools will have movie theaters and then gyms and football games. There are plenty of opportunities. They get to meet same age kids in the building in other social environments. So it's like more appropriately planned and We don't have to go somewhere else like a dating apps or other places to go interact. But I see when they grow older, go out of school, when they go to college and other workplaces, some might find that it's more easier to find dating apps on the internet and interact, especially Asperger's when we talk about adults. Uh, when the school environment, teacher is always there. When they move to adulthood, they are more enjoying because they are on their own to make their own social decisions.
Dr. Raveendar, how different it was when you were in India and you were doing the same uh, intervention for Asperger's, and then when you shifted to US, how are these different?
Yeah, you are right. It was so it's entirely different. Like we can see the other side of the world. You know, when we were working in 2001, we were digging information and looking at each other. And when the kid comes in, we used to have case studies and talk about and learn more and come up with the plan because we didn't have any resources. We are the only 4 or 5 people used to sit together, one clinical psychologist like Dr. Rajesh, and then Nachiketa ji, director, and he's a speech therapist. I'm a special education teacher. We used to sit and talk and then come up with the plan. But here in US, everything is put in a plate, like full meal served here. I don't have to dig for, look for anything. I don't have to ask for sambar. I don't have ask for pickle, right? So when the plan is given, everything is written, printed, white and black, and I have to follow that document. Okay, what I need to do to help social and emotional and then sensory. So because more professionals are working with me, it make more easy for me. Whereas in India, when I was working in 2001 to 2003, I didn't see much about the research or maybe the people working or helping those Asperger's or autism student. Now I see that when the kid comes in, it comes with everything like packed. A package comes in, it will tell me social history, medical history, communication skills, lack of communication, everything comes in. And then there is a plan given. And not only plan, I have to record the progress and I have to show the improvement. I have to show the parent and administrator that, yes, I've been working on this skill and this much progress I made on this because it's more accountable here. That's what I see so far. Did I answer your question?
Yes, yes. I was seeing some hand being raised by Pratiksha. Do you have any questions to the speaker? Mr. Murli, do you have any question? Mr. Murli is grandfather of Vaishnav, who is doing masters in social work at one of the college, and his mother is Dr. Sunanda Murli, as a psychiatrist working with in US, and
Nice.
very good friend of us. And Vaishnav is on the spectrum, but he's quite highly intelligent.
Hmm.
So he's there in the screen and he's listening to your talk.
Oh, thanks for coming, everyone. Um, I would like to say thank you for everyone joining in and listening to me. I appreciate it.
So here we would like to end the session, and I take this opportunity to thank Dr. Raveendar for a very elaborative explanation about Asperger and adulthood, and what all strategies we have to use and how we make a better, comfortable living place for people on the Asperger spectrum. On behalf of the entire participants, I had around 107 attendance today, and on behalf of these participants who are sitting on the other side of the screen, take this opportunity to thank you for a wonderful session. I think everybody can give him the reaction with thumbs up and anything. And thank you so much. Thank you so much, Dr. Raveendar, for a wonderful session. And it is nice to listen to you after a long time.
Thanks for having me. It was nice talking to you guys and sharing what we have been doing here. And it's always, exchange of information. So please feel free to reach out to Dr. Ramchandran. And if you have any resources are needed or any kind of information needed from my end. But I would like to say thank you.
Thank you so much, sir. Thank you so much.
All right.
Now you can leave it, sir. I think it is too late for you. Tomorrow
Yes.
you have your session. So thank you so much. From here, good night and good day to all.
Thank you. Bye.
Dear participants, we have shared the feedback in the chat box. So what you can do, you can fill up the feedback link, and once it is received in a couple of days, that means in 2 days' time, we will give you the certificates onto your email IDs. So thank you. Please do join in our next AE information series. Information will be shared soon. Thank you, everybody. Bye-bye.